Okay, so we're back. We're doing another PRP for a young lady over here. She has a little bit of alopecia right in this temporal region. I took a few pictures and you can see she's thinning. She tried some cortisol shot, but apparently after a while this stopped working. So this is truly the way to go. PRP has a growth factor, but you do have to repeat it, as I said with the other patient. You have to repeat it every 6 weeks to 2 months, a few times for it to be effective. But we also had a patient that only did one treatment and it worked out pretty well. So basically, we took her blood, we spun it down in our PRP machine, and this is what we got from it, about close to 3 cc of PRP. It looks pretty good, looks pretty clear and nice, and now we're just going to use a 30 gauge needle and go right in this temporal area and inject it. And so you don't want to inject it too deep, because you want to be right where the hair follicle is, which is superficial, right into the dermal layer. And just put a little blab in. Now, sometimes if the patient is a little sensitive, I do numb him, but sometimes the numbing itself hurt more than just injecting this with a little PRP. As you can see, it makes a little bolus as you're injecting in, and I fan it around to different area. And that's about it. And then after we'll massage it a little bit to keep it into the scalp. And she's good. Because again, this is not a magic bullet. It's not like you're going to do this and, oh my God, look at my hair growing out sort of deal. But it's all microscopic level. It stimulates the hair microscopically to grow. Thank you.